did you know that persons in their 50s, 40s, and even as young as in their 30s could be affected by Alzheimer's disease? You're watching How to Improve Your Health Using Biblical Principles. I am Arlene Robinson with Dr. Robert Robinson as we continue to bring you this very informative series. Last week, we looked at brain development and attention deficit hyperactivity disorder. And we saw where most of the brain development takes place in the first 2 years after birth and is completed by age 10. And we learned that breast milk is specifically designed to maximize brain development because it is high in energy and in free amino acids, which are crucial for normal brain development. Therefore, it suits us if we want to maximize proper development of our children's brains to breastfeed as long as possible, even up to 2 years of age. And since development continues up to age 10, we need to be supplementing the children's commercial foods with prebiotics and free amino acids. And usually children's food are high energy, so the thing to look for is the free amino acids. One product that helps with this is the Immunogizer Brain Maximizer. Now, having dealt with brain disorders in the young, today we'll be looking at a brain disorder that affects older persons, namely Alzheimer's disease. So we're going to want to know exactly what is Alzheimer's disease, what to look for. Dr. Robinson, could you explain more about Alzheimer's disease?
Okay, Alzheimer's disease is a degenerative disease of the brain, and it's the commonest degenerative disease we see of the brain and causing dementia. So it's very common, and it's seen worldwide.
Okay, so there are different dementias, but this is the commonest of them.
The commonest type we see.
When was this type of dementia initially described?
Okay, Alzheimer's disease was described first in 1906 by Professor Alois Alzheimer, and he's a German psychiatrist. He had a patient he noticed with this deterioration in our mental function and difficulty remembering things. In fact, the name of the patient was August Dieter, and he followed her for 4 years between 1902 to 1906, and he described the changes that he saw in this lady. By 1910, it was this disease was presented in the textbook, and I would say from that time, people have seen it as a specific cause of senile dementia.
Okay, you said the first person was August Dieter, and here we have a picture of this patient. Now, like most other diseases, Alzheimer's is also becoming an epidemic, and World Health Organization findings have shown that the onset is usually over age 65, but in our intro we mentioned persons as young as 30 could be affected. There's an increased incidence with increasing age. For example, persons 65 to 69 years old, 3 out of 100,000 will have Alzheimer's.
1,000.
Out of 1,000 will have Alzheimer's. Persons over 90 years, as much as 69 out of the 1,000, will be affected. The life expectancy of this disease is less than 7 years. Yes. So it is a very crucial disease that we need to be able to deal with. In 2006, 26.6 million persons in the world, or 0.4% of the world population, had Alzheimer's disease, and it's projected that by the year 2030, about 100 million persons, which is about 1.6% of the world population, will be affected by this disease. So it seems to be increasing by leaps and bounds. Alzheimer's is in all countries worldwide.
That's right.
But what has been observed is that it is more prevalent in white countries rather than in black countries. For example, in Canada, 240 persons per 100,000 will be afflicted with Alzheimer's, whereas in Egypt, less than 50 per 100,000 have Alzheimer's. So we see there's a very marked difference there. One famous person who had Alzheimer's and died from it was President Ronald Reagan. He was U.S. President from 1981 to 1989. And what we have here is a picture of a map of Alzheimer's prevalence worldwide. and the darker areas show where it is more prevalent. So if you observe, you see that places like Canada and Australia, parts of Europe, have very high prevalence, whereas if you go across to Africa, it's much lower there. This picture we have here shows another famous person, Charlton Heston. Everybody knows him from the Moses movie. This is a picture of him and Ronald Reagan. Both of them had Alzheimer's and died from it as well. So Alzheimer's is a disease that we need to know about. So Dr. Robinson, give us an idea of how this disease progresses, how we could recognize what's happening.
Okay. People will start showing signs of developing Alzheimer's disease before even you can diagnose the disease. And up to 8 years before the disease is diagnosed, you'll start seeing the person show some deterioration in their cognitive function. You know, they have difficulty in learning things and so on. But their memory will still be intact, right? Now, once they develop the Alzheimer's disease, the first stage, we refer to that as the early stage. They begin to have difficulty remembering things, and the things that most likely have difficulty remembering is things that they just did. You know, like they went in the kitchen and put down a knife somewhere, put down something, an object somewhere, and they can't remember where they put it down. And as time go along, this memory gets worse and worse, and they start forgetting things in the past or in the longer past, and so on. They also begin to have problems like learning problems. You know, I mean, if they try to learn some certain computer skills or certain other skills they didn't know about it, it's very difficult for them. Now, this stage then moves on from an early stage to what we call a more moderate stage. And when you reach a moderate stage, they now begin to have problems in daily activities. You know, like bathing, for instance, using the toilet, difficulty in doing all these kind of little things that they normally would have been very routine things. Right? They might not be at that stage. They don't really need a full-time caregiver, but they'll eventually advance further. So by the time they reach about the 4th, 5th year, they are so advanced that they need a full-time caregiver to do almost all the various activity. So you can look at it as early when you're just losing their short-term memory to advance where they require a caregiver at all times.
So we could observe those among us. If all of a sudden they have problems learning stuff or the memory is deteriorating, we need to get them investigated.
That's right, right.
Now, how is Alzheimer's disease diagnosed?
Okay, diagnosis of Alzheimer's disease depends on the clinical assessment and also the needs for various techniques, investigation techniques like special advanced medical images and doing certain cognitive tests. Usually when a patient comes in, the patient will give you an history, like they say they're having difficulty remembering certain things, they seem to be forgetting things and so on, and sometimes their relatives might say they've been noticing this for a while and so on and such. So that will give you a clue as to that this person may have Alzheimer. Now, when you examine them, you might do some neurological testing on them or some psychological testing, and you're seeing that there's some deficit in their ability to remember things or learn things and so on. So that will again give you some clue. But to really make the diagnosis, you really need to get involved with some tests, which include blood tests and special imagery tests like CT scans and so on. Now, it's very important we do these tests because there are other diseases, especially treatable diseases, that can present like Alzheimer's disease. And you wouldn't want to label somebody as having an Alzheimer's disease, and in fact, he has something else that is treatable. So the blood test and the imagery test is very important. What you might see on the imagery test, you might see little plaques and tangles on the brain scan and so on, with some non-specific kind of change, and this may also suggest to you that this person has Alzheimer. If you see the psychiatrists or some of the neurologists, they will do what they call cognitive tests, and there's some special cognitive tests that they have. Probably the most famous one now is the mini-mental state examination. So this is a special kind of test where they assess the memory and the learning ability of the patient. And by combining all of these features, you can now make a diagnosis of Alzheimer's disease.
So the imaging is critical to
Imaging is very
ruling
important.
out other types of
That's
dementia.
right.
Now, what kind of changes are seen in the brain of persons with Alzheimer's?
Okay, a number of changes are seen in the brain in Alzheimer's. We see changes, what we call inflammatory type changes. In other words, there is evidence that there is inflammation going on. And when we have inflammation in nerve cells, one of the things that happens is tend to lose the sheets that lines the nerve cell, or we call the nerve sheet, or the process is sometimes referred to as demyelination. So you get demyelination of the nerve. So one of the things you will see if you had an autopsy on a person with Alzheimer's disease, you'll see inflammatory changes such as demyelination of the nerves. the nerves connect with one another through chemicals, what we call neurotransmitters, and there's a deficiency in the amount of neurotransmitters that is in the brain for persons who have suffered with Alzheimer's disease. A particular neurotransmitter called acetylcholine is significantly deficient, and this is another feature, a biochemical feature that you see with Alzheimer's disease. Again, as we said, the Alzheimer's disease is a degenerative disease, so you're going to see changes of degeneration. And some of those changes we're talking about, what you see on the CT scan, like the plaques and the tangles and so on, these are suggestions that there's an accelerated degeneration going on, and so these changes will also be seen. So you're seeing inflammatory changes on one hand, biochemical changes on the other hand, and degenerative changes also.
So if you have neurotransmitter deficiency, the brain is literally slowing down because the connections...
Yes, it's slowing down, and obviously that's where the problem in memory comes in, because you need to connect the nerves them together to remember things and so on. If you're losing that connections, then the ability to remember is affected.
Okay. So what is the usual treatment for Alzheimer's?
Okay. The treatment, we tend to target more the biochemical changes.
That's the
neurotransmitters, right. So the drugs that would normally be prescribed for persons with Alzheimer's disease are drugs that tend to increase the neurotransmitters. As I mentioned, acetylcholine is the main neurotransmitter that the deficiency is seen in. And this acetylcholine is produced by your nerve cells, and it is broken down by an enzyme in the brain called cholinesterase. So what they do, we give the patient a drug that blocks the enzyme that breaks down the acetylcholine. So we call that enzyme, that drug, a cholinesterase inhibitor. So you give the person a cholinesterase inhibitor, it will increase the level of acetylcholine in the patient brain, and obviously improve the neurological function. Now you see about half of the patients will respond to these kind of drugs, but the sad thing about it is that the response is moderate, and improvement is temporary. It may last for maybe for 6 months or a year, and you find the person start to deteriorate again.
Continuing the drug.
There are some other drugs they use to more in the advanced stage. There's a drug called memantine, and it's used more often in advanced cases, and it's actually a neurotransmitter itself, and so on. But you try to avoid that drug because it can cause certain psychotic kind of behaviors and so on.
Now that we've seen that Alzheimer's disease is a very serious illness, and we've seen the different changes taking place in the brain, we need to see how biblical principles could be applied to help improve this condition. Remember, the changes we saw in the brain are the inflammatory changes, the neurotransmitter deficiency, and the signs of aging where the brain tissue is degenerating. So we're looking at the first one, which is controlling inflammation. What biblical principle could help us deal with this?
Okay, when we did the biblical principle, the second biblical principle we dealt with was the issue concerning the purity of food. Now, one of the things we did show there is that because of the increased level of preservatives in our food, the preservative is affecting the good bacteria. And as a result, it kills off a lot of the good bacteria and make room for the bad bacteria growing. Now, these bad bacteria that are growing now in the intestine tend to produce a lot of products. We could refer to them as toxin, and these products get into your body. We talk about these toxins getting into your joints and so on, and triggering off arthritis. Now, some of these toxins are also getting into the brain, and it's triggering off inflammation. So obviously, we would need to ensure that the biblical principle regarding purity of food is applied. Now, we said that by using prebiotics will offset the effects of preservatives. These are anti-preservative like products. So by using them with our food, then you can ensure that the good bacteria will thrive. It will result in the destruction of the bad bacteria and prevent these toxins or antigens from entering the body and triggering off this inflammation, including inflammation in the brain. And we show that the immunogizer products are prebiotics and anti-preservative products, and this will be useful to take with your commercial food so as to prevent inflammation.
So the biblical principle of the purity of food, which targets basically your bacterial colonies in your bowel.
Yes.
Once you could get those colonies as they should be, they will take care of the bad bacteria, and inflammation wouldn't be able to get a foothold in the body. And one thing that helps with it is the immunogizer products, which are anti-preservatives. And preservatives really cause the problem in the first place.
That's correct.
So that isn't too hard to deal with. How are we going to apply biblical principles to make sure we could increase the neurotransmitters in the brain?
Right. No, we learn a number of things from the development of the brain and the way how God designed the milk for the brain development. And one of the things you pointed out in our previous episode is that the milk is designed with a high energy and a high level of free amino acids. Now, we said the free amino acids, when they enter the body, they can travel to the brain and enter the brain. They can pass what they call the blood-brain barrier and enter the brain. And free amino acids are converted in the brain to neurotransmitters. Right. Now, it's very important, again, that the free amino acids are protected in the intestine. Because remember, we said the free amino acids, bad bacteria break them down to amines and cause allergic problems and so on. So, again, the issue of a prebiotic becomes very important. So, what you really want a person with Alzheimer's is to give them a product that has prebiotics, so it can protect the free amino acids, and have a wide cross section of free amino acids, which can now enter the brain, enter the body, and eventually enter the brain. Now, a good example of that is the Immunogizer Brain Maximizer. The Immunogizer Brain Maximizer has Immunogizer in it, which is a prebiotic effect, and the Brain Maximizer, there's additional neuroactive amino acids in it. So that's a simple way you could take a food to improve the neurotransmitters in the brain, and as a result, improve the person, prevent Alzheimer's, and improve their outcome.
But you were mentioning that milk has a lot of free amino acids.
Yes, milk has a lot of free amino acids, and what you could do is add the Immunogizer Brain Maximizer to maybe a glass of milk and give that person a glass of milk in the morning, a glass of milk in the evening, or even half glass, and they'll get additional free amino acids from that product, which obviously will improve their neurotransmitters in their brain.
Okay, so the balancing of food is crucial in this. You must have high energy, high free amino acids.
That's right.
The next problem we looked at was breaking down of the brain tissue, degeneration.
Okay.
How do biblical principles apply here?
The first biblical principle we dealt with was the biblical principle regarding the pattern of eating, and we talk about the sabbatical diet coming from that.
Right.
Now, what the sabbatical diet is really a restoration diet. Whenever you fast, your body gets rid of old tissues or degenerative tissues. When you eat a heavy breakfast in the next 6 days, it puts in new tissues. So therefore, if the Alzheimer person or old elderly person is on the sabbatical diet, then they are preventing degeneration from occurring in their brain. They are changing out the parts in their brain, and therefore slows down degeneration. One thing the diet also does is increase the activity of a certain cells which you find in the bone marrow and the brain called stem cells. And stem cells are very important in changing out old cells and putting in new cells.
Now, this is very interesting. We have the same 3 biblical principles that we've been applying to so many other diseases, and it's dead on target for Alzheimer's as well.
That's right.
We look at the problem with inflammation,
Right.
and we see where the biblical principle of the purity of food applies.
That's right. That's right.
And
inflammation, as we said, especially inflammation of unknown cause, its source is often coming from the large intestine, and these inflammatory products are getting in and triggering off inflammation in various parts of the body. So the biblical principle concerning purity of food, which is spoken of in Leviticus chapter 11, is dead on target.
And what is making our food impure is the high level of preservatives.
In the food.
So that's why Immunogizer products, which have high levels of anti-preservatives, will help balance it back and clean up the food. The other problem we saw was decreased neurotransmitters in the brain. And we saw where portioning of food is critical.
Right. The third principle, that's the third principle that dealt with, which is you talk about in Ezekiel 4, verse 9. It's talking about portioning of food, and we see how God designed the milk, and we saw that milk in children is very critical in the development of the brain, including adding sufficient, supplementing the free amino acids or the neurotransmitters in the brain. So again, if you're giving the Alzheimer person a high level of free amino acids protected by prebiotics, you can increase their neurotransmitters in their brain.
Okay, so far it isn't very difficult to deal with the first two parts. The third problem was that the brain was degenerating, seemed to have accelerated aging.
That's right.
And that's where the first principle of the pattern of eating came in. We had said it's a restorative
diet.
Right. So we're going to be maximizing the restoration system. So we're going to be slowing aging. And you had mentioned that fasting day, which is critical. The body going to break down all these plaques and tangles and degenerated parts of the brain. And on the days when we eat the heavy breakfast, the other 6 mornings, we're going to be pushing replacement of these things. But an interesting thing you mentioned was increasing the stem cell. You have stem cells that you need in order to replace the brain tissue.
Yes, yes.
So what exactly are these stem cells?
All right, stem cells are some very interesting cells. These are cells we find primarily in the bone marrow, but they're also found in various other tissues because they leave the bone marrow, circulate through the blood, and into other tissues. And these are cells, sometimes refer to them as pluripotential cells, or cells that can literally convert themselves into any type of cell in the body, and so on. And their primary job is to find damaged cells in the body, remove those damaged cells, convert to cells of that same tissue, and replace them.
Well, that's really amazing.
Yes, that's
so
right.
if you have a heart attack, you could build back in a new piece of heart.
That's right.
Or brain, or wherever.
It doesn't matter where your structure is. God has provided cells for a backup purpose.
We are indeed fearfully and wonderfully
That's
made.
right.
Now, the Immunigizer products, they have a product that is supplemented with stem cells. Tell us how you're able to
There's an
activate
Immunigizer stem cell product, and as it says, it has Immunigizer, so it has a prebiotic. And remember, we talk about prebiotic. You have fast-acting prebiotic and slow-acting prebiotic. Fast-acting to work primarily in the small intestine, slow-acting to work primarily in the large intestine. So the Immunigizer stem cell has the Immunigizer that will allow for protection of the good bacteria both in the small intestine and the large intestine.
So we cover all angles.
We cover all angles.
With that.
In addition to that, it has an extract from blue-green algae. Now, green algae are some little microorganisms that you see in the waters and so on. They cause the water sometimes to get green and so on. And a lot of scientific studies have been done on blue-green algae. And it has found that the extract from blue-green algae increases circulating stem cells. So once a person is taking blue-green algae, the amount of stem cell that is coming out of the bone marrow into the circulation increases significantly. Now, with increased circulation of stem cells, it simply means that stem cells can now do more work. They can go to areas where there is damage, such as in the case of an Alzheimer person, there is damage in the brain, goes in, remove those damages, and replace them with brand new cells.
So if that's the case, we're not only slowing down Alzheimer's, we could reverse it then.
Yes, you can start some restoration processes going on right there.
But this should bring a lot of hope to people out there, because usually Alzheimer's is a death sentence, and people get very stressed out and are tempted to put their family into homes because they stray at night and all kinds of things.
Yes.
So what will be the best way to supplement persons with Alzheimer's disease?
All right, if a person have Alzheimer's disease, I would recommend that they go on a combination of the Immunigizer Brain Maximizer and the Immunigizer Stem Cell. They could add the two together and put in a single container, or they could give equal doses of each at meal time. Now, the reason why you'd want to give the Immunigizer Brain Maximizer, apart from having the Immunigizer and the prebiotic effect, which obviously will have implication in reducing inflammation, the Brain Maximizer is going to give them that additional free amino acid, and that will help to increase the neurotransmitter in the brain. If you add that with some milk, so when the person when they have their meal in the morning and in the evening, they could give them like half glass to a glass of milk. That would also boost the free amino acid. Obviously, you're going to want to give them the Immunigizer stem cell also, because we said the stem cell now will be targeting the degenerative changes and increases the circulating stem cell in the blood, and therefore they can get more repair work and so on. So what I would recommend for a person with Alzheimer is a combination of the Immunigizer brain cell and the Immunigizer stem cell, and they could complement that with a glass of milk.
So we need to get Brain Maximizer and stem cell.
That's right.
To best supplement persons with Alzheimer's disease. So, in summary, let's see what we have learned. Alzheimer's disease is a commonest dementia worldwide. It's fast becoming an epidemic, and it's expected to increase 4 times by the year 2030. It's a progressive terminal disease with deterioration in memory and mental function. But we have seen where we could apply biblical principles and be able to address the changes in the brain. So we could not only slow it down, but we could also reverse Alzheimer's. The changes we saw were inflammation in the brain, decreased neurotransmitters, and increased degeneration. To deal with the inflammation in the brain, all we have to do is clean up the food. That's the second biblical principle of purity of food. And the contamination in the food today is the high level of preservatives. We just need to get a high level of anti-preservatives to counter counteract it, and the immunizer products do just that. We need to increase the neurotransmitters. Remember, this is the chemical that makes the connections in the brain. So, and the food ingredient that's most important for neurotransmitter formation are your free amino acids. This is in conjunction with this third principle of the portioning of food, where you need to have the right levels of free amino acids, which are going to increase your neurotransmitters, and the immunizer brain maximizer has added free amino acids as well as being a prebiotic. The third problem was the brain is deteriorating. It seems to be just falling apart. So we need to be able to get on a program that's going to bring restoration, which is the third principle. The first principle, which is the sabbatical diet, the pattern of eating, where you maximize restoration in the body. And in your bone marrow, there are stem cells there that could replace any kind of tissue in the body. So it could replace the damaged brain tissue. And the immunizer stem cell has blue-green algae, which activates the release of more and more of these stem cells to do the patching up of the brain. So Alzheimer's needn't be a progressive terminal disease anymore once we adhere to God's principles.
That's right.
Next week, we're going to look at the topic, how to slow aging. So all you ladies, get your lady friends and make sure you join us, because aging is a big problem with us, and we want to look as young as ever for as long as ever. But one person who was able to accomplish this was Moses. He died at the age of 120 years, firing on all cylinders.
That's right.
All faculties were intact. And many of us would like to go there. So we're going to examine what went on with Moses and find out if there is such a thing as a fountain of youth. So until next week, make sure you join us. I am Arlene Robinson with Dr. Robert Robinson as we continue to show you how to improve your health by simply applying biblical principles.